so many reasons. There are barrier factors that we face around this region. For example, the socio-economic issues, the legal or laws, and cultural issues. Some countries, as we know, in the Asia-Pacific still implement the punitive laws, especially for the same-sex activities like men who sex with men, that will affect the key population, such as MSM, to access the service. And it, of course, will risk the HIV prevention and intervention in the region. And secondly, after 3 decades, more than 3 decades, the epidemic, but stigma and discrimination is still big challenge for people living with HIV to seek service. And well, based on the latest data from the UNAIDS, we know that Asia-Pacific, in Asia-Pacific, it's estimated that 5.8 million people living with HIV, and because China, India, and Indonesia, we are the populous countries, we contribute for almost 3/4 of the total number of people living with HIV in the region. And just today, because today is the World AIDS Day, the UNAIDS just tweet and then mentioned that about 12 million people with HIV still do not have access to life-saving HIV treatment. And it means that inequalities cost life. And that's what we face. Yeah.
Yeah, as you mentioned, there's a severe lack of access to treatment. So follow up to that question, how do you think that countries in the region could cooperate more on prevention and control and treatment as well?
Well, yeah. I think all regions, the leaders should give supportive, equity, equal and inclusive policy for people living with HIV and also affected by HIV, and should reduce the challenge of law that lead to harmful environment, especially for the key populations, and as well as to reduce stigma and discrimination, to improve their quality of life. That first. And then secondly, during this pandemic, we all know that almost all funding all goes to other priorities, and that makes the epidemic left behind and forgotten. So the leaders should increase their national budget and prioritize their national budget too on HIV to make sure that it will sustain, especially the funds for prevention services. For example, HIV education for school and communities, and put effort for PMTCT program, harm reduction, which so far I know that China is one of good example of providing HR program previously. And prevention tools alternative not only provide condoms, but also provide PrEP.
Yeah. Well, the HIV is a global public health challenge, so countries should be working together to address that. Thank you so much for your insights, Ms. Evi Sukmaningrum.